Welcome yet to another episode of Health Unfiltered. I'm Dr. Eladu Emmanuel, and
I'm Dr. Kennedy Selemba.
so today we just want to discuss and share the role of men during the time of antenatal and childbirth.
Dr. Eladu,
Yes.
do men really play a role in antenatal? Do they need to really escort women when they are coming for antenatals?
To be honest, yes, they really need to escort women. And you see, Dr. Kennedy, the antenatal is a very delicate period during the pregnancy, because this is a time when this woman is going to be exposed to so many things, opinions, rumors, suggestions, okay, from almost everyone, okay, from the passers-by, from the sisters who have been pregnant before,
From a women's group?
women's group,
Yes.
the hospital groups, and all that. So it's very, and even the same thing happens for the men. The men equally keep getting these kinds of informations from the bars, the drinking places, from the church, from their friends, and the parties, and all that. So when a man chooses to escort his wife for antenatal, he's choosing to actually be involved actively in one, getting facts, and two, offering support during the time of the antenatal. And you see, Dr. Kennedy, it's interesting because men go through a lot during the
During
pregnancy.
pregnancy, yeah.
Men go through a lot. I have seen husbands who will come and tell you, Dr. Emma, I no longer sleep in my bed. For some reason, my wife does not allow me to sleep in the bed.
The bed.
Okay. I've also seen husbands who have told me, as soon as I get into my house, my wife will ask me to go and shower because she doesn't like the smell of my sweat or something like that. So you find that men really go through a lot of things that they do not know where to channel.
So they also need support.
They definitely need the support. Yeah.
And doctor, how do you address this issue where people may see it as weakness, like a man who has escorted a woman for antenatal, and they see it as weakness and they take it as weakness, especially in this age where you may find a bit of toxic masculinity being preached around?
Yeah, it's not actually a weakness. It is a sign of strength. For me, I normally tell patients, you and your partner, you form a team. Now, me and the midwives and the doctors are just going to join part of that
To
team.
be the part of that team.
Get it? But already the two of you are a team, and that team has given us a pregnancy. Now we join the team to make sure that you have a successful pregnancy. And outcome. So really, escorting your wife for antenatal is not a sign of weakness. If anything, you're setting yourself apart as an exception to the rule. Because why? What happens when during the antenatal, you get to ask as many questions as possible to the doctors. It's different when I teach the wives. Then the wife comes home and she will not be able to tell you
Exactly what the doctor said.
Exactly.
Yes.
You see? So most times when the woman asks the husband, or I mean, when the husband asks the woman, what did the doctor say? She's going to say, everything is all right. You get it?
Maybe because of what came out of the scan. And
so she's just going to generalize and say, everything is all right. But you see, that is so general that you miss out the gist of the preparations that we are having.
that will come on later.
Okay? So the knowledge that is being shared, the questions you get to ask, you get direct answers. All right. Sometimes men think that women are just pretending, that the wife is aching. That when the woman tells you she wants ABCD, that the cravings are not real. You get it? These cravings are actually real.
So these are things that men miss out
These are things men miss out.
to get from the horse's mouth.
And when they go and meet with their friends, your friend is going to tell them, you see, for me, I cannot do this too. My wife cannot allow me to do this.
Mine wanted this, I said no.
I said no. You get it? So, and you see, when you have that environment, you affect the mental well-being of the woman. You get it? She feels that she is not being supported. And I can guarantee you the number one leading cause of postpartum depression is the woman feeling like she has not had support during this journey.
Actually, it is quite common.
Exactly. So the men really are very much needed to attend the antenatals. But also during the antenatals, don't just sit at the reception, go into the consultation room.
That's a
ask
big
the
one.
questions, all right? Because I sometimes I see men come and sit at the reception, and then the woman goes. And most times I ask the wives, please call him inside,
come in.
because he has some questions. And for me, what I love about this is when I educate the husband, they get so informed that they are able to help the women during the journey. Okay, for example, when I want the woman to monitor the blood pressures, okay, tomorrow if the woman goes home and she wants to monitor the blood pressures and the husband is not involved, then she's going to struggle to find ways of transportation, going to buy maybe blood pressure machine.
Or even if she forgets, it
Yeah,
just ends
if she
there.
forgets, that's the end
There's
of
no
it.
accountability.
There's no accountability. So now the man being present and knowing what to be
He
done
remembers.
helps.
Like
Exactly.
doctor said.
Remember, there is what we call the pregnancy brain. Women
Yes.
tend to be forgetful during the time of pregnancy. But now when you have the husband or the supporter around, these people help you to remember these things. These people help you to execute the plan that you've set out to do with the doctors. And I'll tell you also in terms of financial provision. Okay, we live in an era where, of course, still we know that men are do provide the biggest bulk of the finances, but you'll find that men struggle to provide if they don't understand. Okay, if I ask you for a scan,
If they don't see the reason.
you have come to the consultation room, I've listened to your baby and the baby is not fine. I want you to do a scan. But because the husband is not around, he's not going to see the relevance.
He doesn't see the urgency, the need
of that scan.
The
You get
scan.
it? So the financial bit of it is important. The mental bit of it is important. The psychosocial bit of it, all right? For the woman to feel that she's supported is important. The part where the men get to, because they go through a lot, these men, they go through a lot. Most of them are worried. Every small change the woman is experiencing, the man is worried. Is she delivering? You get it? But when they come and then you teach them and say, no,
that they get aligned also.
before these weeks, don't worry about it.
it.
So you find that they get more confident to offer the support.
The support
They
is
know
there.
that we are not in danger. You get it?
Does this doctor in any way affect also the bonding between father and the baby who's coming?
Yeah, absolutely. I even tell men, from about 20 to 24 weeks, these babies can perceive the sound of the environment around them. So this is a time that you can actually speak to your baby. This is a time that if you're someone who is more involved, you can speak to the baby. You can pray with the baby or pray for the baby. This is a time you can sing for the baby. And these babies are able to, and the interesting thing is that these babies get comfort with this voice. They will know right from the womb that this voice has been around.
Wow.
And they get reassured with this voice. You get it? So by the time the baby is delivered, no wonder these babies feel comfortable when such a person speaks. They're able to hear and be like, oh, I am familiar with this voice. So the baby is able to be comforted. So you find that indeed, knowing that helps you bond with your baby quite well. All right. And I've also seen in terms of preparation for delivery. Right?
Yes.
Women or the pregnant mothers are taken through a birth preparedness session where we prepare them for what happens during the time of giving birth. Now, it is so unfortunate that we only get to prepare the women and not prepare the men.
The men.
You get it? So we reach the time of giving birth and the woman is very strong, but the man is not.
He's not. By the way, doctor, talk about that. There is also this point of after delivery,
yes,
where, for example, we have had cases of men going ahead to demand the conjugal rights usually soon after. Could it also be stemming from not being prepared?
Not being prepared. Preparation of birth, preparation of care after birth is very important.
Because some of those men, they may not want to understand.
They won't. They will assume that, look, you push this baby, we should be good to go in 2 weeks.
2 weeks.
Which is right. Most times we recommend about 4 to 6 weeks. But especially recommend that the sex should be resumed when the woman feels comfortable. All right. But you see, if the man has not had that from the doctor's mouth and the woman is the one telling him this, he's going to think that
she's making
things up. I've seen scenarios where husbands call me and say, doctor, is it true that you've... But you see, that is because the man did not
attend, was not accompanying these sessions.
Okay? I have seen scenarios where men cry in labor wards. Okay? And you see, because the woman is having contractions, especially if she is not on an epidural, if the woman is having severe contractions, I've seen men shed tears. I've seen men become restless. And trust me, it happens even to the very best of us. To even those who think that to the
These
doctors, to
days
the
they
engineers,
say
to the pastors,
the one who think they are gumit.
the gumite. I've seen men cry. I have seen men faint in the labor ward. Yeah. There's a famous story I like saying. One time, one of these patients calls and says, I want the man of God. She was calling the husband man. I want the man of God in the labor ward. So when the man of God walks into the labor ward and then he sees the process of giving birth, he starts asking, why is this place shaking? And then the next thing, he was on the floor.
He also went into labor.
So if, and I guarantee you cannot be strong if you're not prepared. You can never be strong if you're not prepared. So the preparation is very important, because men think, I'll just go into the labor ward and be strong. I kid you not, labor ward is not a joking place. Okay? I've seen people lose consciousness. I've seen people convulse. I've seen people puke, vomit. I've seen people...
And I think after that, such an experience, such a man will respect a woman.
They will. They do. They do.
They'll give them the
I have
due
also seen men who have had
respect.
PTSD because of the birthing process.
Birthing process.
Okay?
But I think for the ones who get PTSD, perhaps maybe expectations were not
they were not handled. So for
Yes.
us as doctors, as obstetricians, we want to prepare you. And it is normal for someone to say, I am not going to be comfortable being in the labor suit.
in the labor
Get
suit.
it? And that's the role of this antenatal and these preparations, to get you to a point whereby you know what you're okay with and you know what is not okay with you, and you should be able to stand by that, because all of this is a form of support. Remember, if you told your wife, I'm going to be in the labor ward, I'm going to be in the labor ward, without having the proper preparation, then you faint in the labor ward.
We also put you on a drip.
Every time you're trying to say something at home, they'll say, but you fainted. So indeed, the men out there, we just want you to take the take-home message is be involved. Be involved from the very beginning. Be involved in the antenatal visits. Be involved in the decision making. Okay?
Even in the scan rooms.
Even
They
in the
should be
scan
there
rooms, yes.
to see
Go and see the baby.
the baby.
Ask the questions. Because this woman is not going to answer all the questions you're going to ask them. All right? Ask the right people the questions, so that you don't have rumors and half-baked information from ChatGPT and all the other people. And then you end up spreading rumors. Come and attend, and trust me, you'll be so much different. You'll be more involved in taking care of your child and your wife, and the experience is going to change you for the better.
Thank you so much, Doc.
It's been a pleasure.